In this presentation, I'll be talking about the ethics of financially incentivized organ donation, as well as its feasibility within the United States. Currently, the U.S. is experiencing a massive organ shortage crisis. Ever since the first transplant procedure, there's been a huge disparity between the number of people in need of an organ and the number of organs that are actually available on the market. In 2018, there were over 6,200 deaths that occurred as a result of this shortage. Although the number of donations and available organs has increased dramatically over the past several years, there still remains a considerable gap between supply and demand. Currently, there are over 112,000 patients on the UNOS waiting list, and an average of 17 people die per day while waiting for an organ. If you look at this graph over here, you can better understand how significant the difference really is. Between 1990 and 2019, the number of people waiting for an organ has increased over 5 times its initial number, while the available organs has barely doubled over the same time period. The most in-demand organs at the moment are kidneys, livers, hearts, and lungs. The US currently functions as an opt-in nation, which relies on altruistic donation and the explicit consent of donors to supply the national database. However, data from the past 30 years has proven that this clearly is not enough and that there needs to be some type of change in the way we donate and harvest our organs. One of the most popular proposals is a transition to an opt-out system. This system presumes everyone to be an organ donor unless they explicitly state that they do not want to donate. Nations such as Spain, Italy, and Russia currently use this and have reported relative successes and improvements in their donation rates. Obviously, there are more factors that go into why their donation rates have increased, but this is one of the most widely discussed and considered suggestions. There have been many other strategies that try to minimize the gap, such as unrelated living donation, living donor paired exchange, ABO incompatibility transplants, and expanded criteria donations. To introduce the topic of this presentation, financially incentivized organ donation is a proposed system that hopes to minimize the gap between available organ and number of people in need of a transplant by increasing the number of donations. The way it works is that an individual would be able to donate their organ for a direct financial payment. The amount of money has not been specified yet, but based on proposals and other papers, it seems to range between $10,000 and $150,000. As of right now, the Uniform Anatomical Gift Act and the National Organ Transplant Act of 1984 bans the actual buying and selling of organs. However, the current state of organ donation clearly indicates the need for change, so it's possible that this policy might be repealed in the near future. For pros, for pros of this program, one of the leading nations with a government-regulated and financially compensated transplant program is Iran. They first adopted the system for renal transplants in 1988 and has experienced a massive surge in organ availability. You can see from this graph that over the past 20 years or so, they've completed nearly 2,000 transplants, which is a huge improvement from just 6 transplants in 1984. In fact, the increase was so considerable that Iran was able to eliminate its renal transplant waiting list in 1999 and has not needed to reinstate it since. To quickly go over the way this works, the government covers all hospital expenses and provides the necessary immunosuppressive drugs, and in return for donating, the donor receives a financial award and federal health insurance. Additionally, as of 2005, Iran reported only 4 perioperative deaths out of over 18,000 live donor nephrectomies. The relative safety demonstrated by this statistic suggests that in weighing a cost-benefit analysis, the relatively limited harm to donors in return for a greater and much broader societal benefit offers pretty strong justification for possibly implementing this system. And in addition to its relative successes in Iran, this system also offers the opportunity to decrease black market operations. Currently, 10% of all international transplants involve some type of illegal trade in organ trafficking. But with a well regulated and legal alternative, people would no longer have to turn to such illicit and oftentimes dangerous activity. It is also important to consider that as healthcare professionals, doctors have the duty to respect the autonomy of their patients. Autonomy is one of the four core ethical principles, and it's widely agreed upon by the medical community that all manifestations of autonomy by stable and competent patients should be accepted, especially given that cases such as abortion and refusal of certain treatments are clinically allowed. It follows that individuals should be able to decide whether or not they want to donate their organs. For the con section of this system, despite the despite the possible benefits, there has been a lot of criticism towards this proposal, and the primary argument provided by healthcare professionals and ethicists is that this system operates directly on the commodification of the human body. By assigning a certain monetary value or worth to organs and other body parts, some say that this devalues the sanctity of human life and makes us no more than inanimate carriers of marketable parts. As preservers of human health and well being, this is an ethical gray area for healthcare professionals to be in because it doesn't fully align with their professional duty and seems to contradict the sanctity of life that these professionals promise to uphold. This is a quote from a paper that argues for the preservation and respect for the human body and life by referencing the way in which slavery degraded individuals from holistic, dynamic beings to beings that were manipulated and used for the benefit of others. Some people have argued that not allowing individuals to sell their organs violates the autonomy principle. Like I mentioned before, examples such as abortion and refusal of treatment are frequently referenced as examples of manifestations of autonomy. However, in the case of in those like previously mentioned cases, the medical team is responsible for assessing whether or not the patient has the capacity to provide fully informed and psychologically sound consent. However, in the case of this proposal, when monetary compensation is added, it's almost impossible to fully determine the validity and reasoning behind the individual's consent. Doctors cannot fully determine with 100% certainty if a patient's decision to sell their organs was of their own volition or if they were coerced by financial burden, family influence, or societal pressure. Additionally, this system implicitly operates on the exploitation of vulnerable and impoverished populations. Socially marginalized and unstable individuals are much more susceptible to societal and financial pressures and are likely to look to organ donations as a means of an income. In nations that already have this type of system, these trends already exist. In Pakistan, for instance, nearly 70% of donors were slaves and 90% were illiterate. In Iran, 84% of donors were of low socioeconomic classes. And even after the donation, the financial compensation barely helped these individuals, with 85% of them reporting no improvement in their economic status. A majority of donors, 98% of them actually, reported a decline in health and chronic pain due to the large incisions from the operation. Therefore, it's important to think about how this operation not only affects the current state of the donor, but affects their future well being as well by hindering their ability to find and maintain a career that would help improve their lifestyle. Also, rather than evenly distributing the burden of the organ shortage crisis equally throughout society, this type of system places a responsibility solely on the shoulders of the weakest and most vulnerable members of our community, oftentimes for the direct benefit of members of the higher class and those who are more privileged. When considering the feasibility of this proposal, it's important to consider the social context of the United States. The US is already suffering from a massive economic and health disparity that clearly is not sustainable, and negatively affects the lives of thousands of people across the nation. Implementing a financially incentivized organ donation system would only serve to worsen this issue. Also, given how different the socio-political and cultural climate of America is from that of Iran, it's risky and naive to assume that a similar system would produce the same kind of dramatic increase. For instance, even if such a system were put in place, studies have shown that a direct payment of $10,000 for a live kidney donation would only yield a 5% increase in donation rates. Given the labor and effort that this system requires, as well as the risk it poses to the most vulnerable members of our community, 5% is a seemingly trivial increase. Many have suggested that the money and effort that this system would be better used in other strategies that I will be discussing later. Additionally, the ethical permissibility of this proposal is very ambiguous. The way it commodifies the human body and treats it as an object you can just take apart and sell has been a very sensitive topic for many. Allowing this to legally happen would raise more questions and debate about the value and sanctity of the human body and what it means to society. This also places healthcare professionals in a very uncertain and ethically ambiguous situation, given that this situation given that this proposal seems to go against their code of ethics. Ultimately, the organ shortage crisis is still a huge issue that has to be addressed. While I don't believe that implementing a financially incentivized system is the right solution, one thing I feel that the US can do right now is focus on removing financial disincentives first. What I mean by this is that donating an organ is already a pretty expensive and time-consuming process, with it costing around $6,000. But by removing financial barriers such as travel expenses, lost wages, recovery expenses, and more, the U.S. could help make donate. The U.S. could help make donating more accessible and possible for many. Another possible step, like we mentioned before, is moving to an opt-out system. Spain has already demonstrated the benefits of this system and is the leading nation in the number of donated organs for the past 26 years. Finally, funding social education and outreach programs has the potential to dramatically improve donation rates by minimizing the stigma and uncertainty surrounding it. There are already some programs in place, but focusing more on this can help improve awareness. Additionally, funding more training programs for healthcare professionals to help them become transplant coordinators could help improve the organ harvesting process and not let any organs go to waste. At this point in time, it's become clear that the US needs to implement some type of systemic change to address this issue, given how unsustainable our system currently is. There are many steps the US can take, but considering the social and economic context of the country, as well as the societal implications of the proposal, is the best way to create an efficient and effective donation system.